Do people experiencing homelessness have equitable access to primary health care?
Okay. So I am going to answer this question thinking once again about LGBTQ2S people who are experiencing homelessness. And the answer is no. Okay, that's like right off the bat. I'll say no, they do not. And I think for LGBTQ2S folks, especially those who are experiencing homelessness, trying to access equitable access to primary health care it's very complicated. It's very complex actually because once again, not knowing what to expect, not knowing how, the physician or, whatever type of service it is that you're trying to access, how people are going to respond to your needs. And so many of the sort of healthcare services that we do have in place, they're not necessarily, population based or population specific. And so they're not always prepared to respond to the needs, appropriately respond to the needs of LGBTQ2S people, particularly for trans people who are seeking support around medical transition. So I think that access to primary healthcare continues to be very complicated and actually quite difficult. And a lot of the young people, who I work with often talk about the fact that they don't have a physician. They're not able to access primary healthcare because they don't have a safe place to go to in any sort of specialized LGBTQ, health clinic. The wait list is usually, incredibly long. And so for a young trans person who's very seriously wanting to medically transition, going onto that wait list where you have to wait a year just for for a referral and, then just for an appointment, that can be very long. That is a very long time. And that's a very crucial time point for many young trans people. If they're at the point where they're waiting to transition, they're waiting for hormones or for access to surgery. And we know that, for example, suicidality can really sort of be very heightened during those time points. So there's a lot of work that has to be done with regards to providing access to healthcare.
I imagine too the sort of being not able to find a stable place to stay makes that challenging as well. Because if you are on a wait list and you're waiting to be contacted, but you're maybe moving around through different services or you're couch surfing, it would be a lot harder to actually locate you when you do come up on the list.
Yeah, that's right. Absolutely.
Even if you do access primary care, sometimes there just isn't the understanding or empathy. This was years ago again when I was just sort of exploring being out and so on, expressed to my primary care giver here in Peterborough that I was gay, and I had a book that I was reading. I said, this book sort of explains for me how I feel, and the response was, I don't want to read something like that. I don't want to pollute my mind. You know,
Yeah. Hmm.
I'm not sure that that's still, well, I'm sure it does
Yeah.
sometimes, but
Unfortunately, I think it still does happen.